have with us Dr. Indra Jayasuriya, endocrinologist, who will be discussing with us childhood obesity. Welcome and good morning to you, Doctor.
Good morning, Salia.
Doctor, this word about childhood obesity has become a really big buzzword. How would you describe childhood obesity?
Yeah, no, that's really a good topic to bring because the childhood obesity is sort of increasing. The obesity means overweight. Yeah, so this used to be a problem of the adult or towards the sort of later part of the life after 50s and 60s, but over the last 10, 15, probably last 5 to 10 years, I think this become a problem of our youth, particularly young children, adolescents, teenagers, and also even the younger children as young as maybe 2-3 years old.
And that is, would you put that down to the fact that, they have a lifestyle of being on the computer, iPad, telephone, less exercise, or could it be the diet, the junk food and all this unhealthy food that is around?
I guess that's $1 million question because no one knows the answer, but extrapolating from things from few decades ago to now, so we can see, obviously our lifestyle has changed, so the children tend to be less mobile, and then they more sort of attached to their iPods, iPads and things, and I mean they spending more time in front of the screens. So I guess that play a major role in respect to this. Whereas if you go back like 20 years, so maybe to our childhood, I'm not going to tell you how many years ago, but then we usually used to play on the street, and we used to play with other kids, neighbors, and I mean, how often do you see these things? Children are spending outside. So the children used to play after school to the sunset outside, but now they're spending more the screens. And the same time, and the food got much richer. So the children tend to have more fatty, more sugary food, and more sugary drinks, energy drinks, sport drinks. And also I guess because we're getting wealthier, so as a result of that, the portion sizes are increasing as well. So I think all these factors play a major role.
So it's a combination of food, combination of lack of exercise, and how do you address it? Are we going to sit and wait and say we're not going to do anything about it? As a doctor, what is your take on it? How would you address it?
Yeah, I think it's a very difficult thing because you can see how the diabetes, type 2 diabetes, which used to be a disease of the older people, so which we now started seeing in like children under 20, so which has become a major issue.
Is it because of the obesity brings on other diseases?
Other diseases,
would you say that?
Yeah. So they tend to get diabetes and premature onset or the early onset of the heart disease and things like that, and the other conditions like sleep disorders like sleep apnea, and also the depression is quite common among the children who are obese, because of the bullying and all those other factors. So there are new set of diseases appearing among the children, which is which is not only in the Western world, like if you go to places like Sri Lanka or India and Pakistan. So this is emerging economies also facing with these similar sort of medical issues now. I mean, to answer your question about how to deal with it, I think it's again, I mean, the disease caused by the multifactorial issues. So the disease again has to be dealt in multiple ways. I guess the parents should play a major role regarding the preventing your children getting obese. I mean, I should also mention, I mean, apart from these environmental factors, obviously there are some genetic factors as well, because some children has a genetic predisposition to they're prone to become overweight children.
And that's hereditary?
Could be hereditary, yeah.
So it's not a lifestyle factor, you wouldn't say, or is it a disease?
I mean, rather than calling disease, I would like to say it's a condition. Yeah.
Okay.
I mean,
health condition?
Health conditions. So if we don't sort of address that and prevent the child getting overweight, so I guess it can cause the long-term effects such as developing diabetes.
So it's a lifestyle factor as well, and you call it a condition, a health condition. Parents should take the responsibility of getting their children exercising, making sure that they do sports. I think even schools are getting more emphatic and more focus on sports. Would you say, I mean, if you exercise regularly, you become healthier as well, mentally and physically?
Yeah, that's right. Yeah. I mean, you should set up. I have young children as well, so this is a continuous battle. Trying to control their screen time. Yeah. So most of the the research shows children should not have a screen time more than 30 to 60 minutes per day. Yeah. So which include your TV, iPod, iPad, all those times. This is out of the school time. And then the rest of the time they should do outside activities. It could be walking, running, playing organized sports like cricket or basketball or something similar. That's right. Yeah. So and the summer times they can do cycling or whatever the sports or whatever the activities, physical activities, they have to do at least 1 hour a day.
1 hour a day,
1 hour a day or more children should do, and the main thing is just minimizing the screen time. So the other thing is that then we have to be careful with their food intake, So I think we should try to sort of minimize things like energy drinks, soft drinks. I think soft drinks is a very big problem in children.
The sweetened soft drinks.
Yeah, or things like also the Coca-Cola and Fanta and all those other soft drinks, because they also have very high energy drinks. Yeah.
What about things like fruit drinks and?
I mean, the fruit drinks are healthy because they have nutrients, vitamins and things. Again, I mean, consumption over like things like orange juices, apple juices and things, because they provide a lot of calories, so which can also increase the weight. So, I mean, the fruit juices are fine as long as you limit them. Yeah. The other thing to control, fast food. I mean, children have to have some fast food, but as a parent and the guardians, I think you should limit the frequency of that. Yeah, maybe I don't mind, children having once a fortnight or once a month or something. And then you should encourage them to eat more vegetables, lean meat, cut down the refined carbohydrates, like biscuits and cakes and all those sugar stuff.
That responsibility will lie with the parents. I mean, a child's diet and the food intake, I would say, lies totally on a parent's responsibility.
Yeah, I think it's important to sort of teach them from a small age. Like when you pack in your school lunches and snacks and things, I think it's always better to choose the healthy choices rather than non-healthy choices. Yeah? Yeah. And also like drinks, I think always better to send them to school with water rather than the other kind of drinks.
Yeah. Most schools now have healthy food as well. Their canteens carry healthy food. They make it a point to make sure it's healthy food. So I think it's a lifestyle choice, it's a food choice, and the responsibility of parents that combines all this to make sure that our children stay away and not be obese as such. Would you say, is there a general benchmark for obesity or a measurement?
I mean, there are various measurements you can do, and we can use the height and the weight ratios. I mean, I'm sure the family doctor can help, and also they can measure abdominal girth and all those other things. And the best way to recognize is all the children in Australia has a childhood health record, and which has the lines. Some lines is 10%, and then the some lines is 90%. And ideally, and this is in ideal circumstances, your child should grow around the 50th mark on these charts, because these charts actually go from the memory until 13, 40, or even beyond that. So if your child is sort of getting close to more 90th or 80th percentile line, they should really see the doctor, and because your child is gradually getting overweight. I think that the important thing is if you have a childhood obesity, it is very likely that persists into the adulthood as well. So it is better to sort of control the weight as a child rather than waiting they go beyond 20s, because often we know 3 out of 5 children who obese as a children will persist into the adulthood obesity. Whereas if your child is lean during the early development, then 1 out of 5 children will develop into the adult with obesity. So the other thing is there are other conditions can cause childhood obesity. So there are medical conditions. If you're eating, very healthy diet, and if the child is trying to be active, and still child is gaining weight, or if they suddenly started putting on massive amount of weight, I think you need to see the doctor, because there are conditions, like thyroid conditions, other conditions with the adrenal gland, and all those other things can cause excess weight gain and increase appetite. But that's quite rare. But then it is also important to sort of recognize that.
So to summarize, it's a choice of the parents how they manage their children's diet, the exercise, less screen time. So it's overall responsibility of the parents to make sure that childhood obesity is controlled.
Yeah, I mean, it's the parents and teachers and us, and also the showing sort of I guess if your family is more active, so if we eat healthily, and I guess that gives the children a lifelong lesson how to manage their lifestyle.
That's a great insight into childhood obesity. Thank you, Doctor.
You're welcome.
There's no better place on earth. Yeah, I dream of you, Sri Lanka. Yeah,
I pray for you.